Outside Simonetta Collision and Car Care, it's a frigid 2 degrees. Inside, Gary Simonetta's employees are getting ready for a pretty heavy meeting Gary has been dreading for months.
What I have here is the benefit sheet from last year, what you were on in 2013.
Charles Moore has handled the company's group health insurance for 19 years.
Here is the new plan that we had to switch to that takes into account the Obamacare regulations.
As our cameras roll, 47-year-old Dave, who's single, Judy, a 53-year-old mother of one, 39-year-old Brian, who also has one child, 48-year-old mother of two, Christy, and Jeff, who's single and 42, all find out for the first time how the Affordable Care Act will affect their medical coverage and how much they're going to pay for it.
Jeff, there's yours. And I just folded these up because they are private numbers for everybody. It's what your new monthly premium is going to be for this plan.
Last year's 6% premium increase has now exploded fivefold to an average 32% jump, and that is just for starters.
That 32% increase includes increasing the deductible as well to try and get something modestly priced.
Look at the numbers. Jeff and Dave used to have a $1,250 deductible. Since Obamacare went into effect, it's now jumped 60% to $2,000. That's nothing compared to Brian, Christy, and Judy, who have kids. They're going to pay twice that, $4,000.
This was the best option we could find.
Copays are up too.
Where it used to be your primary care doctor copay of $20, it's now going to be $40.
Since Obamacare went into effect, pediatric dental and vision exams are covered. That's a bonus for Brian, Christy, and Judy, but not for Jeff and Dave. Generic drugs are also significantly cheaper. We ask each staffer what they think of their new deal.
Deductible's terrible. I mean, how many people actually can come up with that deductible money if they get into an emergency room?
Dave's monthly premium goes up modestly by about $50. Christy, though, not so lucky. Her monthly premium jumps $260. That's 30%.
$895 a month for health insurance. It's coming out of my pocket. That's a house payment for most people.
Brian actually saves $77 a month, but that $4,000 family deductible,
it's going to be a pretty big hit in the pocket.
And Jeff is in the same boat.
They call it the Affordable Health Plan. There's nothing affordable about it. I can't afford it.
His new premium is only $28 more a month, but Jeff says he's going to have to suck it up if he ever gets hurt because that deductible is just too much.
Wake up, America. This isn't acceptable. It's not acceptable.
But it's 53-year-old Judy who gets hit the worst.
What's your increase?
From $929 to $1316 a month.
That's a 42% increase added to her new $4,000 deductible.
How do you add all that together?
How are you going to do that?
I don't know.
Back in the shop,
we're going to replace this RAD support.
Owner Gary Simonetta has his own worries. His monthly premium just jumped $584. That's 63%.
The small businesses are the heart of America. So how's that going to affect everybody? It's not good.
Broker Charles Moore agrees.
One size does not fit all in medical insurance, and unfortunately that's one of the big downsides to the Affordable Care Act.
Downsides that leave Judy wondering if she can ever afford now to get sick.
I don't know how President Obama thinks that he's helping us. Because we can't afford this. We can't afford to pay these copays, to pay these deductibles on what we're making.